to my channel. If you're meeting me for the first time, I'm Agatha Agbenu Sam Ofe. You can call me Agatha the midwife. Today I'm going to be as brief as I can, and I'm talking to you about something that I thought is very important for us to know because of the time and the season that we're in here in Nigeria. This is rainy season, and I just went down memory lane and I remembered that about this time last year I was admitted in the hospital for malaria in pregnancy, and I thought, oh wow, this is actually rainy season. A lot of people should know, women should know that it's about that time where a lot of persons get sick and are treated for malaria, pregnant or not. But because I am the midwife at your service, I am going to be a little biased for my pregnant mamas. So malaria. What is malaria? Malaria is a disease that is caused by the transmission of the Plasmodium parasite into the red blood cells of a human being or a host. And how is this parasite transmitted? It's transmitted by the bite of a female Anopheles mosquito. So what are some signs and symptoms of malaria? The signs and symptoms are not different, outside of pregnancy, but the signs and symptoms of malaria are headache, generalized body pain, fever, joint ache, loss of appetite, alongside nausea and vomiting, and all the other early signs and symptoms of pregnancy, like the morning sickness and all of that. But I am particular about pregnant women because during pregnancy, a woman's immune system is generally low. Her immunity generally drops to make allowance for the growing fetus. So now we have talked about the definition, the signs and symptoms of malaria in pregnancy. How can you tell that a person has malaria? When a woman is pregnant, you don't guess, okay? You don't guess signs and symptoms to say, oh, I feel like this, so maybe this is what it is. Because like I mentioned, her immune system at that point is really fragile, and we don't want you introducing anything into your system that is going to affect you and fetal development. So it is best to go to a hospital, speak with your physician, speak with your midwife. When you feel uneasy, don't assume, don't think that you know it all. So what do? How do you diagnose that this is malaria? So the first thing is history taking, then physical assessment, and it will always culminate in laboratory investigations because blood samples must be taken, to run the test and ascertain that there is the presence of the malaria parasite in the red blood cells, so that we don't just assume and treat. And it's always important to treat. So these are not steps for you as a pregnant woman to take, but you must visit the hospital. History taking is going to be, they will ask you questions if it's your first pregnancy or not. Every information that is needed for your health worker or your healthcare provider to give you the best care. Please do not withhold information. Physical assessment is going to be done. That is assessing, the general outlook of the woman, and then laboratory investigations would also be carried out so that she can be properly treated. So that being said, we have talked about the definition, the signs and the symptoms, the diagnosis. How do we treat? Please don't self-medicate. What I'm going to emphasize on in terms of treatment is what we call intermittent preventive therapy, IPT. And these things, this treatment is usually emphasized on during antenatal. What is IPT? Like it's called, intermittent preventive treatment, it's a therapy or a treatment that is given to a woman in the course of pregnancy to prevent malaria in pregnancy. It's what we commonly know as fansida, okay, but medically we call it SP, sulfadoxine pyrimethamine. It's a medication that comes in 3 tablets, so one dose is 3 tablets. When it's prescribed, you're told to take the 3 tablets at once, and it started as early as 20 weeks of gestation. That's about 5 when a woman is about 5 months pregnant. And it's always advised that a woman takes this treatment before her 3rd trimester. because that's about the safest time of pregnancy that she can take this medication to avoid. Remember, we are concerned about our fetal development, so we do not want anything that alters, normal development of the baby. And like I said, it's a medication that comes 3 in 1. Each dose is 3 in 1. So you're taking the first dose is 3 tablets, the second dose 3 tablets, the third dose 3 tablets. You start as early as 20 weeks gestation, and then that's for the first dose. The second dose comes 4 weeks after the first dose, and then the third dose also comes about 4 weeks after the second dose. So even if a woman does not start as early as the 20th week, what matters is the fact that it should be taken before third trimester, because even if you start the first or the second, once you have crossed into your third trimester, which is, you're closer to delivery, it's not advisable. Your healthcare provider would have to restrict you from taking it. And then other non-pharmacological methods or non-pharmacological measures that you should take as a woman: keep your environment clean, okay? Avoid stagnant water, dirty water, as much as you can. You're pregnant, you're not sick, so try as much as you can to keep your environment clean. It's very, very important. And then avoid staying out late, especially if you have to be in an environment that is bushy. You find mosquitoes a lot, really, most times in dark places. So if you must be out late, put on long sleeves, socks. Make sure that your feet, your hands, places that mosquitoes could easily have access to, keep yourself covered, as much as you can. Avoid staying out late. Make sure that your environment is healthy. Use your long-lasting insecticide nets, mosquito nets. Make use of mosquito nets. We cannot overemphasize it, especially now that it is rainy season. You don't know where these mosquitoes how they just find their way in, but use your nets. If you're not going to use your nets, use insecticide. If you think that you're not comfortable, use insecticide. Prevention, we say, is better than cure. So my pregnant mothers, please pay attention to this and start antenatal care as early as possible. Don't take for granted the things that you are taught at the antenatal clinic. Take your routine drugs, okay? And make sure that you adhere to these preventive measures. If you are already pregnant and well above 20 weeks, that's about 5 months, you can do well to speak to your healthcare provider and get IPT so that you can start on your first dose, and try as much as possible to take it before your third trimester, because it's about the safest time that you can take it. I hope that you have learned something from this video. Feel free to leave me any questions in the comment section or in my DM, and visit the nearest hospital close to you for further information. If you feel you want to know more, any midwife or any nurse, good one, will be willing to attend to you and give you the best service that you can. Before I come your way again, don't forget, stay healthy and stay happy. This is Agatha the midwife saying bye for now.